اللي هي الجلو زي الجلو. فit's nerve glue, so it's structure next to the neurons, and it would not just transfer or just do a pulse. So they are not excitable. They do not transfer or transmit electrical signal, and they do not have the ability to do an actual potential. So again, this is the neurons تتذكرونها أكيد مرت عليكم. ف we will go into the structures. الأشياء اللي دائما مهمة we will go into details فيها, بس I will just point it. I want to move this up. So we have cell body, I cannot move, a nasal body, a nucleus, cytoplasm surrounding. في هنا why this cannot be moved? Okay, cannot move this. This is the axon. Okay, this is river of nodes of Revens, and this is the Schwein cells. And we have here a segment, okay, an initial segment, and it go conduct until you have the axon terminal, which is synapse. We call it end bubble. We will go into it in more detail now. But this is an overview of how the axon look like. Let's start with it. The neuron structure we are now زي ما يقولون again cross section, صورة أقرب للموضوع. yes عبد الله. We don't do recording because you're supposed to be in this lecture. We don't do recording anymore. Cell body. We have all the neurons have a cell body with زي ما قلنا nucleus, زي أي cell body, okay, and cytoplasm. That's usually زي أي cell in the body. اللي هي النيوكليس والسيتوبلازم. فما نعرف الشيء بالعربي. if you wanna look it up you can. We have cell body are in cluster usually. Cluster يعني تكون متجمع زي هنا ها. هذا cytoplasm, okay, هنا ها, وهنا neurofibers. This is the nuclei and nucleus. So this is the nucleus and this is the cell body. They are clustered together usually. We will talk about this and this later on. So cell body are in clusters. However, in CNS و PNS تعرفون شو الفرق الحين؟ Peripheral central. The central nervous system, the cluster called nuclei. Okay, so when you cluster them together, like here, they are nuclear. Okay, when they are outside of the CNS in the PNS, we call them ganglia. Okay, so these are the two different terminology you have to be aware of. Cluster of cells, they have different name based on their location in the nervous system, either in the central nuclei, and the PNS, the peripheral, the ganglia. Okay, so these are usually what we look at. This is the structure. We have دائما تعرفونها اللي هي dendrites. Okay, what their ability, this is the dendrite. Okay, if you see it here, this here, وهذه البرانشز. Okay, so what they actually do, conduct impulse toward the cell body. They're receiving end. Okay, it just receive information and it will actually traffic it or actually direct it into the cell body. Okay, بشكل عام تذكروا فيها كأنه طريق برانش. اوكي، البرانش على سبيل المثال الطريق الفرعي يودي للطريق الأساسي أو وسط المدينة. This is what it does. It just get the impulse or the information, let's call it. They usually short but highly branched, تكون متجدعة بشكل جدا كثير. And unmyelinated. We will talk about myelation later. بشكل مختصر, myelinated and unmyelinated, it depends on the speed. إذا كانت البرانش أو الستركشر myelinated, it will transfer the information higher at a higher speed level مقارنة unmyelinated، لكنها ما تأثر على حسب السيرفيس. They surface specialized for contact with other neurons. So what they actually do انه either we will talk بعدين بآخر المحاضرة انه where it get this information from، من النيورونز، من المسلز، ومن الجلاندز ايضا. ف we will talk about where they contain a neurofiber والنسل body. This is the nasal body this is the neurofibers. Okay, these are small things. وهنا برضو النasal body which is these. Okay, وهذه الميتوكوندريا إذا تتذكرون ميتوكوندريا. Okay, they responsible معليش الخط هنا ما ادري ليش مو واضح. They responsible for intracellular transfer of material through the cells. فاذا كان عندي يعني material او اي شيء او اي زي ما يقولون على سبيل المثال waste او nutrition, this is what it will give you the information اللي هو intracellular transfer of materials through the cells. طيب الاكسونز it will just هذه اللي هو بدايه الذيل. اوكي، او التوصيل. اوكي، كانها توصيله يعني بشكل مصطلح عامي. فit conduct الامبولس او الاشاره away from the cell body. وصلت السيل بادي dendrite، وصلت السيل بادي. السيل بادي will process this information and it will go into the axon. Okay, they are long thin cylinder process of cells. They are cells. Okay, they usually arise at what we call an axon hill. Here you will see it. Here it's more clear. هذه النود اللي هي تبدا من هنا ها. hillock. Okay, this is the axon hillock. فزي الجيت خلينا نقول. اوكي، الجيت اللي تبدا منها بعدين الانيشال segment of the axons. ف it will just get the information, impulse it and then transfer it to the axon. واضح؟ ف this is what it does. It usually involves raises from زي ما قلنا الانيشال segment قبل شوي تكلمنا عنها او trigger zone we call it, because you need enough actual potential to get the trigger. اوكي، وهذه اذا تتذكرون في شويه كيمستري we will just touch base on it. انا عارف انه في تخوف من الكيمستري والكيميكال كيمستري بشكل عام، او عفوا الاورجانيك كيمستري. ما في اورجانيك. They usually do side branches, we call them collateral end to a fine process called axon terminals. So they branch. okay، بعض الاحيان هذه الصوره ما واضحه here. So they sometimes branch like this. Let me change the color only. مو واضحة. I think you can see it بس معي ما هي واضحة مرة. هنا ها تكون باينة. Okay, this is the branch here. Okay, the axon collateral. Okay, so sometimes it does have a branch إنه تطلع عن main axons. Okay, sometimes they do branch through it. What's unique about them also, they have a swollen tip. Okay, called the synapse end. This is it here. هذه هي swollen end. It's the end balls contain vascular fluid with neurotransmissions. So هذه اللي هي axon terminal. This is where we release neurons will release information to the either other neurons, muscles, wherever. Okay, they have synapse ends. Okay, they have the neurotransmissions, the neurotransmission information. Okay, we will talk بعدين على السكشن الداخلي، وراح نتكلم على nucleus of the Schwann cell. راح نتكلم على Schwann cell بشكل جدا مختصر، وراح نتكلم هنا كيف انه الامبولس يقفز. اوكي، بسبب النودز اللي هي موجوده. يقفز وها بسبب المايلينيشن. it's myelinated. It goes higher and it's actually information. I mean, the impulse will go higher. Just briefly, this is the nucleus of the Schwann cells. We will talk بالبارت الثاني عنها هنا. ها شفتوها? This is it. You are surrounded by cytoplasm. You're surrounded by neurolama. Okay. And this is the node زي ما قلنا. This is actually the myelinated section or section myelination, which is here. This is the myelination. Okay, فit myelinate, and the myelination will increase the impulse transmit ability, okay, or the speed of it. واضح؟ So باختصار this is هنا راح نتكلم بشكل جدا بسيط عن بعض الاشياء اللي نعرفها. We have زي ما قلنا dendrites, اوكي، اللي هي البرانشز زي الشجره تمتص الانفورميشن it give it to the cell body, the cell body junction of axon زي ما قلنا to the hillock and initial segment which is here زي ما قلنا, and this is the axon زي اخر شيء الاكسون terminal, and the synapse ends we call it the bulb. البulb كانها يعني انوار زي التريجرز للانوار. فwhat happen, you receive stimulus, جالس انا امشي من هنا, you receive stimulus through activation of chemical or mechanical gate. اوكي تتذكرون هالجيتس حقت الايكون channel and sensory neuron produce generation which we have either اذا تتذكرونها excitable or inhibitor, okay, post synaptic potential. These we receive the information and activate a channel, okay, so the channel will open, so we will get information. That's what we mean by it. The trigger zone, we talked about it here لانه you have to pass it, so it integrate ال EPSP وال IPSP, and if زي ما قلنا لانه not all information goes is deputized through the threshold, they actually get an intentional action potential, so pulse will happen. It's actually conduct زي الكهرباء, it conducts a nerve into the initial segment and it goes to the axon. Okay, that's what happened. It does not change as it actually prograde or conduct through the axon, so information keep going. هنا في الاند او التيرمينال الفلو تذكرون CA2 اللي هو شو كالسيوم cause depolarization again phase of the nerve cell to release. Okay, so you now release the extine of synapse to the vascular which is زي الفيكلز اللي تاخذ الانفورميشن. ف this is a plasma membrane including the channel gate هنا في البدايه. This is plasma membrane include voltage of Na plus and K plus اللي هي sodium and potassium, and آخر شيء here we have voltage gate of actually calcium. آخر شيء هنا. ها واضح؟ it's a little بس انها كانها ريفيجن بشكل عام. If you have any question, just let me know, okay? Or if you want a point that need any further information, let me know, okay? طيب عندنا transport, okay, الاكسونال transport او التنقل بشكل عام. ف we have you transfer substance from the cell body to the cellular process and actually utilize the microtablet. Okay, through it. Any cells, you need circulation through it. The cell body is located for most proteinal synapse, so they have the neurotransmission, they have the repair of the proteins. Okay, we have two directions of it. We have the interrogated, which is away. We have the retrogated, okay, which is from the cell's body. So they are away, and we call everything away as an afferent from the cell body to the cellular process تحت, away from the cellular process toward the cell body. This is afferent going into. Okay, this is a cross section هنا لها. We look at it from here. We have this is afferent, this is afferent. Okay, you have to get الانفورميشن بالذات اللي هي النيرو ترانسميشن وبرضه الويست والماتيريال البروتين الماتيريال. You have to get it both ways زي الهاي واي. Okay, integrated or retrograded. Integrated is from the cell body to the cellular process. The opposite with the retrograded from the cellular process to the cell body. Again, with it, we're still talking about the transport system بشكل عام that it's solid. We move substance into a slow phase when we have fast. Of course, we would have a slow action flow and we have a fast. لأن بعض information we need to get as quickly as possible. بعضها it can take time. It's fine. So usually with the slow, it's movement in only one direction. It's away from the cell body. Okay, it move 1 to 5 millimeter per day, so it's very very slow مقارنة في الفast. الفast they move organelles and material along the surface of the microtubules. They move at 200 to 400 milliliter per day. They either go into either direction. They go away from the cell body or towards the cell body. Okay, they use for recycling in the cell body. Recycling من ناحية الwaste ومن ناحية dead body cells, all of these things that need to be transported. This is how it looks like. This is the fast flow. So you go all the way زي ما قلنا. You release a neurotransmission and membrane recycle here and then go up. So the first phase is that's how it looks. Again, this is not clear, but it's the same again. One way or two ways. One way in the slow, it's away from. Two ways or back and forth if it's fast. طيب, of course with every condition there is abnormality وهذا معروف الشيء. فالfast exon transport route by which toxin or pathology usually reach the neuron cells body. These are major diseases. Cutaneous toxics, okay, or toxicity. عشان كذا تاخذون tetanus shot. Is a serious illness that cause seizures and severe muscle spasm. من قوة spasms ومن قوة المشاكل it could actually cause a fraction of the spine من كثر ما الشخص يصير له spasm يرتعش. It's very severe illness. البكتيريا could enter through a puncture or laceration بسبب الانجري. Usually that's why we really rush people who have a head or neck because the transmit time is very short للسنترال والبريفرال لان اغلبيتها في السباينال كورد والبرين. Okay, that if you remember, that's why we would rush people to the hospital if they have these type of injury causing them. Again, with the neuro cells, with every cells there are variety. Okay, we have three divisions or variety based on the number of the process found in the cell body. We have here the mitopolar neurons. Usually it has several dendrite here, several, and one axon. الأكسون اللي هي الخط الواضح هذا one axon. They are the most common cell type. Usually this is the most common. However, we have bipolar, we have unipolar. Bipolar neuron is one main dendrite. تلاحظون الفرق? Only one dendrite. It goes to the cell body. That's how we count it. Okay, it's one dendrite only. It goes to the cell body and one axon. هذا الأكسون, one axon, found in special senses such as retina للeye والinner ear والolfactor واللي هو حاسة الشم لأنه you don't want mix information from different dendrite. Subhanallah, it's just one dendrite, one information or one channel of information. Unipolar neurons is one process only. They develop actually from the bipolar, this one, they actually one process. So they are always sensory. They located in the dorsal root of the ganglia. And we will talk once we talk about that. So they have multiple dendrite لكنه فقط one process, okay, or one process only. So it's not, it goes this way directly. Is this clear? Should be. So functional classification of the neurons, again, we have with everything there are different function to every neurons. If you remember revision we talked about, we have sensory, which we call afferent neurons. They transport sensory information from skin, muscle, joints, sense organ, and الفيسكر to CNS اللي هو central nervous system. We have the motor, which is the afferent. It sends motor nerve impulse to the muscles or the gland. Okay, so you receive information, you need a feedback. So the feedback is through the motor. We have what we call an association or an intro neurons. They are connecting the sensory to the motor neurons. They usually 90% of the neurons in the body. طبيعي ليه؟ لانه جسم الانسان كبير، فوين ام looking على سبيل المثال على sensory في السكن في الهاند او في الفينجر you have a sensory afferent, okay, لكن you wanna get this information الى السباينال كورد، من سباينال كورد الى البرين، لكن الى سباينال كورد you need something in the middle, and this is the intro or association neurons or intro neurons. Okay, that's why it contains 90% of the body of the neurons. That's why there are many of them. If you see pictures of them, they are what we call association. They usually named for the people who describe them or their appearance. يعني على سبيل المثال اللي على اليمين B is a pyramid cell, and you could see it here. بينما Purkinje cell is in the left. هذا الشخص اللي هو اخترع أو شافها، أول واحد شافها. So you would see information goes from multiple direction, and it will send this information to another neurons here. Okay, it goes from a neuron to another neuron. This is the other one, which is the Purkinje. You see how many branches? There are so many branches. It could actually receive information from multiple neurons from here, and will process it, and then it will send it again. Again, this is how we look at it. You see how شكلها سبحان الله. This is the Purkinje cells. They usually in the cerebellum cortex in the brain that related to التوازن ومشاكل التوازن الbalance. We have the pyramid cells of cerebral cortex. Okay, this is the cerebral cortex type, and this is the motor neurons of the spinal cord, which what you usually look at, but they are different, especially in the brain. They look totally different. كمية الانفورميشن كثيرة ولا؟ should be easy صح؟ No. Okay, type 2 خلصنا الأول. فlet me ask, is there any question في الجهة الأولى اللي هي النيورونز الاكسايتبل اللي تمشي فيها transport عفوا transmit of electron signal or pulse we call it. If not, we will go to the supporting cells, which is the gila. Okay, they are زي ما قلنا non-impulsive transmission or transmitting. They mean neuron glue, so they are stuck next to them. Okay, why this? Okay, oh, yes. Okay, so usually we will. Yes, yeah, برسمتين كلها fast. There is no ما في رسم السلو لانها ما راح تبين لك السلو. Slow is the only different. It goes one direction. بس ما في لها رسمة. So let's talk about supporting واللي هي الجيلة usually we call it. they usually smaller cells than the neurons. They are typically smaller. They can divide very quickly. They can be divided very quickly. So they do rapid mitosis to the coron and the tumor formation. So they are usually suspect of cancers. They glomus, okay, cancer type of cancer. بسبب انه they have ability to divide very quickly because they are supporting it would be needed in the body. So هنا ها في الصورة this is it here تراها كلها جدا ما هي باينة لأنها surrounding a neuron. This is the neuron, okay? It's surround the neurons usually. We have different type. We have the astrocyte. This is the first one. We have the oligodendrocyte, which is this one. عفوا اسمها جدا صعب. oligodendrocyte اتوقع. ومايكروجيليا اوكي. والاخيره اللي هي ابادونا اللي هي الابيدونيولا. These are the four types. We're going to talk about them in the CNS. Again, subdivide them: CNS, PNS. In the PNS we have Schwann, it's easy, and satellite cells. They are very easy to know برضه. بالPNS we know where we are looking at. Okay, واضح. Let's go through them. They look very very different. So هذه اللي هي let's go actually by them now. Again, they أول شيء إنه بالCNS. Okay, واضح. It's in the central nervous system. الاسtrocyte. This is the astrocyte. astrocyte من astro. ليش سموها astro؟ لانها شكلها زي الستار. This is it here. شكلها زي الستار. ف two type fiber and protoplasmic astrocyte. Sorry, they are star-shaped cells. They actually form blood-brain barrier (BBB), and we're going to talk about this in the next hour by covering اللي هي الcapillaries. Okay, اللي هي العروق أو blood vessels بشكل مختصر. ف they are here. They cover all of this. If you see here, 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 they cover it. So they زي ما قلنا إنها it actually process of the neurons and blood supply. They metabolize neurotransmission again. So they move the neurotransmission information. They regulate the K اللي هو البوتاسيوم balance, especially the gate. They provide structural support to the neurons. Okay, and neurons then next usually to the neurons. Oligodendrocytes, okay, which is really difficult to say, is in the CNS. Again, it's the most common glia cells type usually. You see how the neuron, it's next to it. It's really next to the neuron. So they support. They actually have a really, really unique thing. They each formate myelination or myelin sheet around more than one axon in the CNS. So their function is, you see, they do myelination. This is the myelination here. Okay, they actually similar, let's call, in the PNS to the Schwann cells. Schwann cell, they actually produce myelination. واضح؟ الفيرست الاولى اكثرها blood barrier اللي هي الاسترو. it's blood barrier عفوا brain blood barrier. Here it's more of a myelination function للاولي or oligodendrocyte. Easy? Not much. واضح؟ Okay. Usually what I would let's finish لأن باقي 2. This is how it looks here. Again, this is a here. Okay, you see what it does? It goes here, it goes here, it goes here, it goes here. Okay, the axon of the neuron. What they do actually, they segmental myelination. So they cover a cell body with the myelination. Okay, so you see it here. This is it. It is next to it. So they give the myelination. This is the neuron. Okay, this is the neuron. So this is the myelination or the myelin sheet. It goes. So it's around the axon with the myelination. So they have the cytoplasm, the nodes, and then the mitochondria inside. So they myelinate it. With myelination, we know the information will go or will be the impulse will go faster or action potential. المايكروجليا واللي هي again بالسي ان اس we only talk about CNS. They are small cells found near blood vessels usually or near blood vessels. They are اللي هي الباثوتونيك or pathological or pathogenic role. They clear away dead cells. Okay, that's their function because you need something to clear away the dead cells, and this is how it, you see, it clear the debris outside. So this is the cell. It goes واللي هي المايكرو gila cells and it clear the body. عفوا الدبريز or body cells body. They derive from cells that can give rise to the microphagia والmitochondria, which is usually what fight الانفكشن, الاوتوimmune infection. Again, this is how it looks. So what they actually look like, all of them. Let's start with this اللي هي تكلمنا عنها الأسترو. Okay, you see it's Astro. It's really next to what? To الcapillaries. Okay, our blood supply usually. Okay, فit give الباسيف والbackward. Okay, information. This is the neuron. This is the neuron ganglia and its interaction to it. المايكروجاليا here والمايكروجاليا here actually برضه. It actually take الwaste from neurons وfrom blood vessel. Okay, it take neurons. So this is it here برضه. Okay, it actually debrided to astro site والastrocyte will move it again, will move it يعني انه cycle. This is how it looks. One is the microgalia here. It's next to the neuron, and neuron next to the astrocyte. الاسtrocyte usually it's next to اللي هي التشعبات الدموية الكابيلاري. اوكي, التشعبات الدموية. التشعبات الدمويه بعدين عندنا داخلها فيه المايكرو او جنبها جدا جدا قريب من البلد فيسل is المايكروجليا again. So المايكروجليا will take the waste, move it away to the astrocyte. The astrocyte will move it away to the neuron and neuron will give it again to the microglia. واضح؟ So this is how here it looks like. If you actually look at them, this is الأسترو. على طول تعرفونها لأن شكلها زي النجمة. Okay, I'm gonna highlight it here. بعدين تبقى highlight it in another. This is the neuron. Okay, this is the oligandrias. Okay, this is usually المicroglia. Okay, and this is برضو المicroglia again here. This is the capillary, okay, which is a blood vessel, and this is the blood vessel. Let's circle it now in a different color. So star shape is what? Astro. Okay, this is the astro, and this is the fibers of برضو astro. Okay, not two types. Their location is different. It's not types, it's to their location only. We're gonna talk about this later, okay? آخر واحدة الإبيدومال. It's the next slide. So this is اللي هي الأسترو, okay? النيرون معروف مكانه. This is it here, هذا النيرون, okay? All of it. Next to the blood supply, we have this big cell here, and this is الثالثة اللي هي المايكرو. is surrounding. Okay, واضح. This is more of an inside cut. واضح ولا لا؟ confusing شوية confusing لكنها بسيطة when you look at it. Yeah, it is a little confusing. لكن متى ما تبدأ تناظر عليها تعرفها. يعني عندنا باختصار let me just clear this. Neuron, okay? With the neuron نعرف خلاص, we know about the neuron. We don't want to talk about the neuron anymore. Okay, we ignore it for now. We have اللي هي الastro, okay? It's usually next to زي ما قلنا blood vessels, okay? It's usually next to blood vessels. What its main function? بنذكر المين function حقتها الاستروسايت اللي شكل النجمة. What's the main job? Blood barrier, okay? A blood-brain barrier. So that's why it's next to it here. So it will regulate what goes inside, what goes outside, okay? To it, but that's why it's next to it and next to the neuron because it will transfer the information to it. الثانية اللي هي الإيليغوندينياستيا هذه what its main function? Myelination. طيب where it's supposed to be? It's supposed to be next to the neuron. See? It's next to the neurons usually. No, sorry. Here. You see it? It's next to the neuron. Okay? Because it gives myelination sheets to it. الثالثة اللي تكلمنا عنها المايكرو كلا. What is function? It's near from the blood supply. So it's supposed to be here. This is the blood vessel. Okay? This is the blood vessel. فit will give الwaste information. Okay? عفوا الدبري الwaste اللي من النيورونز it will take it and put it here. Okay? So regenerate. That's the purpose. Not immune cells, it's just clearing. So it's debrising. Okay? فthat's their functions. They look okay. Okay? في باقي الأخيرة راح نتكلم عنها هنا which is here. So let's look at it. It's easy. It's the easiest is the ependymola. Okay, this is the ependymola. It's in the CNS again. We have cella. We have a cells حقتها. What they actually do, they formate epithelia members lining the cerebral cavity and the central canal. So what they actually main job and really important job, they produce the cerebral spinal fluid, CSF. So they are like surrounding راح تشوفونها بعدين وين نلقاها بالventricles والspinal cord. Okay, inside the spinal cord or inside the ventricles. So they actually here. So they give CSF واللي هو السيربيال سباينال فلويد لا انتم ما درستوها كنت بقول لكم سباينال بيفيدا it will actually usually we will look at it بعدين على سبيل المثال. That's why this subject is very important لانك بعدين في البيدياتريك على سبيل المثال في condition we call it spinal bifida. Spinal bifida is leak of the cerebrospinal fluid. Usually من البرين we do a shunt أو من الspinal cord we have to do a surgery. They do a surgery. Okay, this is why it's really important to understand these cells. They are the surrounding cells. طيب بالBNS again PNS we have satellite, we have Schwein. Satellite cells near the cell body. However بالBNS what do we call a cluster of cells body تتذكرون؟ What do we call it? Clusters of cell body. Do we call it neurons or what? Ganglia. Okay, so just be careful. It's ganglia. Okay, because it's not in the center nervous system. It's a flat cells surrounding neuron cells body in the peripheral ganglia. Again, supporting neuron in the PNS ganglia. So this is it, satellite. You see it? These are the one. طيب Schwein, which is really important. مقارنة لو تاخذها مشابهة للأيجلو الأيجلو أندرياسيا. فcells encircling the PNS axon. So you have axons in the peripheral nervous system, and this is what is surrounded. Each cells produce part of what we call myelination sheet surrounding an axon in the PNS. واضحة. So this is the Schwein cell. It's here. This is the myelination sheet الأصفر, and this is the axon. axon داخلي هنا. myelination. Who caused it? Schwein cell. Easy صح؟ مرة سهلة. Okay, we'll go to the next. Same function, but in the more cells. What I would recommend for the future, after you finish this, جيب ورقة A4 واكتب cells. Divide them into زي ما قلنا central و peripheral. Under the central types with their function, under the peripheral what's their function. Okay, I want to take a 4 minutes break or 3 minutes break, and then I will come back. I need to drink some water واحط السلايدز الثانية. Actually take a break until 9 لين الساعة 9 تقريبا. Okay, if you have any question, direct questions here. Okay. Should we resume? نرجع نبدأ. Let's get started. Okay. So again, this is part two of the same information. Now, however, we're going to talk about the blood supply usually to the brain and what we call BBB, which is blood-brain barrier. We will mention myelination in both CNS and PNS. We will talk about the regeneration and repairs within the nervous or the nerve system, and we're going to touch base on the synapse بشكل جدا مختصر. Let's talk about blood supply to the brain. Usually we have arteries that branch in what we call circle of Willis on the base of the brain, or we call it the foramen, okay, base. It gives supplies to the huge brain. The vessels on the surface usually penetrate the tissue of the brain. You use 20% of our body oxygen and glucose need in that brain only. It's a huge demand. Blood flow to the area increase with the activity in that area. إذا كانت على سبيل المثال جالس زي ما يقولون تركز كثير بالقياده او على سبيل المثال بلعب الكوره او بنشاط رياضي يكون في الدومين عاليه في البرين بعد فذاتس واي you would increase that blood flow and increase the intake of glucose and the oxygen. Deprive of O2 for 4 minutes will cause you permanent injury. خاصة في الغرق إذا تذكرون يعني أحداث الغرق وأهميتها because that time will release الأنزيم اللي يسوس. برضو واحدة من الأشياء المهمة ولما نتكلم عن البلاد سبلاي it's not we're not going to talk about this in here لكن حنتكلم عنها بعدين بالبلاد سبلاي وبعدين برضو في المادة حقت الستروك اللي هو البلاد انجري عفوا الستروك which is a clot or damage to the brain عفوا to the usually blood supply to the brain area. ف it's a good information to have. Also we have blood brain barrier لانه مو بكل الانفورميشن should pass from the blood to the brain and vice versa. it actually protects cells from toxins and pathogens اللي هي البكتيريا او بعض الامراض. Examples of material that does not go through the BBB اللي goes السكر الجلوكوز والاكسجين والكحول وبرضه انستيزيا اللي هي المواد المخدره بشكل عام. It does not go البروتين لانه you don't need it. انتي بايوتينيك والانتي بوديز بشكل عام ما تروح و some drugs usually will not penetrate. The titan junction that cell اللي هي تكلمنا عنها الابيثيليا cells continue the basement of the membrane with the ester process covering the capillaries. Let's talk about it here with examples or pictures to illustrate it. We know it's a specialized barrier formed by endothelial cells, and this is it here. You see these endothelial cells, okay, and the estrogens اللي هي الاسtrocytes which prevent. Here is the astrocyte. This is the astrocyte. هذه هي تذكرونها الاستروسايت سيل في السنترال لانه راح نتكلم على السنترال وراح نتكلم على الثانيه. This is the astrocyte, all of its cells. It prevent large proteins and charge muscles عفوا molecular from entering the CNS. Okay, so this is what will happen. They influence the passage of substance between the capillaries and the neurons in the brain. So they look like this typical blood vessel. Okay, we have it in both sides. يعني على سبيل المثال في blood vessel we have the endothelial cells which usually have a gap here and here. برضو من جهة النيورونز، هي ما هي بنيورونز، هي protective of the neurons اللي هي البادي سايد نيورونز، اللي هي الاسترو سايت، هذه السل كلها. you see it actually have just targeted places where it will go to the blood supply and exchange or uh, allow passing for some material and not the other. So that's the barrier. It's from both sides. They clear from the blood vessel and from the brain function, which is in the actual cells, which is the astrocyte cell. طيب blood brain barrier, endophilus cells line in the inside of the capillary and mediate diffusion of substance from blood directly into the interstitial fluid. Here inside it looks like this. This is it. هذه هي السيلز هنا ها. it give information انك تقدر تطلعها ولا لا. بعض blood supplies. Okay, and this is the blood. Okay, supply. it give information انه او a barrier for something to diffuse and something not to be diffused. Okay, فالبروتين it will go through regular channel here, not through it, through the diffusion. The process of اللي هي الcell اللي هي الastrocyte cell have an end field which cover most of the surface in the capillaries. فusually زي البصمة تحط في كل مكان هنا وهنا 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 علشان وشه؟ علشان تاخذ الانفورميشن، مو بالانفورميشن عفوا، تاخذ الماتيريال اوكي من البلد ولا it will release it to the blood. فالبلد سبلاي نفسها زي ما قلنا عندنا اللي هي السيل will form line and that line will go inside or outside, plus برضو اللي هي الاسtrocyte cell will have an end feet عفوا an end feet which is زي البصمه تحطها زي بصمه الرجل على الكابيليز to cover most of the surface. علشان وشو؟ علشان اخذ الانفورميشن بدال ما يعني على سبيل المثال مو بالانفورميشن عفوا الماتيريال، بدال ما انتظر من هنا وتروح لين هنا ها وتوصل، خلينا نقول هنا عند الاند فيل، الاند فيل ممكن ناخذها من هنا ها على طول وتوصل اسرع للبرين. طيب again زي ما قلنا they control passage of the molecule between them. واضح شكلها؟ هذا هي في tight junction، في اللي هي الاندوفيل سيلز والاسترو، هذه هي الفيل زي الفيت زي البصمه اوكي عليها، وهذه اللي هي السيلز داخليه داخل الكابيلاريز او فيسلز، وفي الجنكشن we're not going to talk about الجنكشن. فتعطي الانفورميشن، فما هي باتاتش لو تلاحظون في زي الجاب، والجاب هذه السايناب and we're going to talk الساينابز اخر شيء. is this واضحه ولا شوي معقده؟ Can you hear me? اوكي اذا كانت معقده let me know. طيب مايلينيشن هي شوي معقده، بس هل هي كلير من ناحيه كبيكشر ولا ما هي صعبه؟ في تو تايبس، في اللي هي داخل السيلز زي ما قلنا، عفوا داخل الكابيلر which is usually اللي هي السيلز اللي هي الاندوكراين سيلز، وعندنا الخارجيه اللي هي الفوت الاند فوت it's usually from the astrocyte cells. طيب myelination, process of myelination you will talk about PNS okay في ال peripheral nerve system. Schwann cells myelinate wrap around axons in the PNS during usually fetal development. عشان كذا كنت اقول لكم ان واحده من الكونديشن واشهرها، مو باشهرها اللي يعني واضح فيها المشكله في المايلينيشن كانت اللي هو السباينال بيفيدا. Schwann cells cytoplasm and nucleus form form the outmost layer of the what we call it neurolemma, with interior protein being in the myelination sheet, tube guiding growth through repairing themselves. فبشكل جدا مختصر this is the Schwann cell هي وهذه السيتوبلازم وعندنا النيوكليوس داخليه هذه هي النيوكليوس الداخليه. This is unmyelinated axon. You still have unmyelinated axon. So what would you do؟ الشواين سيل زي ما قلنا surround it تسوي زي التيوب عليها تغطيها واضح؟ فتجي تدخل عليها وتغطيها تغطي الاكسون اوكي وفيها الاكسون لاما والنيوروفايبر زي ما قلنا الاكسون لاما هنا الاقرب منها فوات هابن رابط الرابنج هذا ايش يسوي؟ يسوي المايلينيشن. So this is the myelination sheet. You see all of this is myelination sheet. خارج المyelination sheet we have a protector area which is called neurolama. Okay, and we're going to talk why it's really important the neurolama بعد شوي. واضح؟ عندي نيرون I want to protect it. شوان سيل تدخل عليها تسوي لها زي السيركلينج بعدين تسوي زي شيت around it. الشيت هذه تعتبر هي المايلينيشن خارجها نيرولاما. واضح؟ Yes, should be. This is easy يعني تعتبر. لكن إذا كان عندي deficit ومشكلة في المايلينيشن it will be clear. وواحدة من الكونديشن راح نتكلم عنها بالادلت MS. Myelination however in the CNS هذا اللي قبل شوي PNS peripheral. في CNS is different. So زي ما قلنا اللي هي السيل اللي هي الايجلوغاندريست cell myelinate the axons in the CNS. They are bored flat cells processing grabbing the CNS axon, but the cell's body does not surrounding the axon. هذه هي واحدة من خلينا نقول مو بالمشاكل الشيء التعقيدات انه the cell body would not surround the axon فما تقدر انك تسويها زي قبل شوي تخليها encircle it. There is no neurolama لاني ماني قادر اغطيها كامل زي ورا ما اقدر اسوي النيرولاما هذه الداخليه اوكي عفوا الخارجيه الموست outlier. There is little regrowth after injury is possible due to the lack of what we call distinct tube or neurolema which is اللي هي surrounding ما اقدر اغطيها كامله. ف let's look at it here. We have an axon. This is the وشو peripheral اوكي nucleus وشواين تشوفون شكلها زي السيركل اوكي circular. ف that's why myelination sheet works here. بينما هنا هذه هي this is the myelination. فالmyelination will go this direction. It cannot go زي ما يقول 3D يلف على كل السيل. ف that's one of the problem. We don't also have زي ما قلنا اللي هي التغطية الكاملة على النيوكليوس من السيل اوكي ما اقدر اغطي عليها كلها فما عندي نيرولاما اوكي ف that's why it's hard to repair or regenerate or regrowth after an injury. Again gray and white matter we touch base on this. فعندنا two types في السنترال وبالبريفرال. في عندنا الوايت والجراي ماتر. الوايت ماتر is myelinated. That's why process white color in it. The gray matter they are nerve cells body. They are dendrite. They are axon terminals. They bundle of unmyelinated axons. Okay, or neurogalia. We talked about them. Spinal cord. That's a spinal cord here. Okay, in the spinal cord, the gray matter it form an H shape. شو شكلها H كأنه حرف H. That's H shape. Inner with the inner coast surrounded by the white. Subhanallah. ليه؟ In spinal cord you need all of the information. You need to send it directly للbrain. You need the white matter to be in the outmost surface. لأنه myelination you need to transfer this information very quickly inside. صح ولا لا؟ That's why and then send it to the brain. بينما let's look at the brain. In the brain the thinner out shell of them is a gray matter. هذه كلها gray matter. Cover the surface and is found in the cluster of the nucleus inside. بينما الداخلية عفوا this is gray، بينما الداخلية هنا ها this is white matter. واضح؟ فتوصل لك الانفورميشن بسرعة هنا للبرين، والبرين can actually send it very quickly للكورتكس الخارجية. توصل للكورتكس من الثالاموس والهايبوثالاموس this is the ventricles ف that's why color different في ventricles. ف this is gray matter هنا ها okay and this is white matter. This is gray matter برضه ترى. This is gray matter, this is white matter. واضح؟ Is it clear? Yes. فبشكل عام انه في البرين في السباينال كورد you're surrounded by white matter. The white matter will send it to the gray matter will send it back. It will start with the gray matter here and white matter, and then we will go to the white matter, and then we'll go to the cortex for signals. طيب regeneration and repairs. Plasticity maintained throughout life. كان أول الاعتقاد إنه البلاستيسيتي will stop at whatever age 15 16 بس فعليا we can see cell divisions or plasticity حتى مع شخص عمره 80 سنة بعد stroke injury. There is sporting أو زي الزرع للنيو dendrite synapse of a new proteins, a change in the synapse contents with the other neurons. So there is plasticity. That's one thing. However, we still have limited ability to regenerate or repair. In the PNS, we can repair the damaged dendrite or axon only. Cell body we cannot. We will talk about it. CNS or central nervous system, no repair are possible. لكن في الفترة الأخيرة في احتمالية بعض الريبيرس، لكنها بشكل عام جدا جدا مستحيلة أو شبه صعبة، شبه مستحيلة خلينا نقول. فنيوروجينيريشن in the CNS formatting of new neurons زي ما تكلمنا أول from stem cell was not thought to occur in the human. كان في اعتقاد إنه ما تصير، لكن عام 1992 they grow stimulation of the neurons in adult mice brain cells to multiply. في عام 98 new neurons found to form within adult human hippocampus, area of important learning بالداخل hippocampus, and this is in the central nervous system. So factor preventing neurogenesis in the CNS أول شيء it's inhibited by neuroglia cells بسبب إنه it's surrounding ما هي إذا death في النيورونز died طيب اللي جنبها نيرون اللي هي supported او تتذكرونها الجلو نيرونز ف what they would do they die okay فما في function absent of growth and simultaneous factors which what we mean by انه ما تقدر على سبيل المثال النيرون will send it to the other neurons ف that's what happened. lack زي ما قلنا النيورومايلينز او النيورولامز النيورولامز اللي هي surrounding body اوكي اللي هي زي surrounding sheet. repair formation of scar tissue how can ما في زي الفانكشن على سبيل المثال في الجرح عندنا تحط الطبقة العيدية بعدين تجي طبقة الجرح we don't know the function mechanism of it. there is no يعني إذا صار في cut في السنترال نيرفس سيستم how can we repair it ما في شيء معروف اوكي والى الحين ما في شيء معروف. ف let's talk about repair within what can be done within the PNS وهذه تنظرونها دائما على سبيل المثال بعض المرضى اللي هم عندهم incomplete spinal cord injury incomplete مو complete cut ف there are some regeneration or repair okay and they will gain some of the function مو all of it some of the function there is still a lot of work to do. so زي ما قلنا axons with dendrite they might be repaired if however the neuron cell body remain intact cell كلها هذه ما فيها أي مشكلة. Schwann cells remain active and form a tube لأنه تحتاج Schwann cells myelination أوكي وهي اللي تسوي الرابنج تتذكرون scar tissue does not form too rapidly. إذا كان scar tissue يعني هذا هو السكار tissue الانسري side ما يصير rapidly يتقطع كل شوي. It's just one side clearly. الكيموتلاسيس which is happen after the injury, this is what happened. انه لو تشوفون في البرين عفوا في البي ان اس, it will do this. It will actually after زي ما قلنا 24 to 48 hours after the injury, and nasal bodies break up into fine general body, and تتذكرونها كانت هنا النيزل, اوكي, واللي هي هنا ها. We will see it now in a picture which is clearer. So here in 3 to 5 days اللي هي learning degenerative occur, breakdown of the axon and myelination sheath, myelination sheath distal to the injury. Anything distal will be repaired. We have to cut it off زي ما نقول, نقطعه بالأساس. Everything behind it. عشان كذا ها إذا كانت هنا الانجري you cannot repair لأنها داخلة في السل, okay body. So that's why. Within several months regeneration occur. What happened? اللي هي نتكلم دائما عليها النيرولاما on each side. تتذكرون ما قلنا في الاوتر layer, هذه هي الاوتر layer نيرولاما. It actually in each side of the injury they repair, they form a tube, so the Schwann cells mitosis زي ما يصير لها زي البريك داون, فتروح فتجي هنا تنزل وتنزل هنا ها. فالاكسون buds grow down the tube with reconnecting to 1.5 millimeter per day. So it goes down until it reach another neuron, or it will actually do what we call اللي هي السينابس, form السينابس آخر شيء. واضح ليش إنه النيرولاما مهمة وليش الشواين سيلز مهمة بعد. That's the purpose for it. Or one of the main purposes لها. طبعا synapse, with everything we need transfer of information من إلى, زي الجنكشن, زي البوينت. إذا على سبيل المثال ركبت الباص وتبي توقف من نقطة إلى نقطة ثانية, this is it here. So الجنكشن أو الستيشن حقت المترو, the point in which two neurons usually communicate. In the nervous system, a synapse is a structure that permits neurons or neuron cells to pass an electric or chemical signal to the other neuron. These are junction between. This is the junction here. This is the junction. Information is passed usually chemically, unilateral. It's only one direction. Okay, من السيناب إلى الريسبتور. الريسبتور هنا, dendrite هنا ها. This is the neurotransmissions. Okay, اللي هي الchemical. This is the axon تذكرون. وهنا synaptic vesicles وهنا synapse. هذه السينابس in both sides. it will release an information. ما في touch, there is a space between them اللي هي نسميها الجنكشن أو الجاب. The two neurons have usually pre-synapse towards the synapse versus post-synapse membranes away from the synapse. Most usually neurons have both. They either receive ولا send information. They receive, that means they are pre-synapse, or post-synapse, they will send the information themselves. فأغلبية neurons, they function this way. We have a pre-synapse here, okay, it goes to the axon. This is the terminal and this is the synapse. It goes to the other, okay, neurons. This is the dendrite of the other neurons, and it will send the information to it. Again, ما في touch. This is the synapse junction here. Synapse or cleft, actually, this is the actual name, cleft, okay, or الجاب. هذه هي. Here we have the gap. هذه كلها gap. Usually synapse can be, تعرفونها من الكيمستري, either you excite ولا inhibit the actual potential. It depends on the signal, or it depends on the chemical passage. You either excite the postsynaptic potential or you inhibit the postsynaptic potential. Why this is slow? Okay, yes. So neurons can synapse within, okay, other neurons, muscles, gland. واضح؟ فما هي فقط النيرون واحدة. Synapse with other neurons. A neuron happen here. This is the dendrite. This is the synapse with the other neuron. This is the axonoma زي ما قلنا, and this is the neuron, the other neuron. So you see, this is the dendrite, and this is where it synapse. Okay. With the muscles, you have the same information. This is the collateral to the coronha branch اللي يطلع على برا, ما نحتاج تعرفونه. This is the new عفوا neuromuscle synapse. It's different type of synapse because we don't synapse it with another neuron. So you see الفورميشن كيف شكلها غير. We have terminal pulsed, we have terminal. Okay, these are the thing, and this is the skeletal muscle here. آخر شيء اللي هي neurogland or neuroglandular synapse. It's to a synapse, and you can see how it looks different مع gland cells. واضح؟ So we have different synapses. Clinical relative, why all of this information is very important. طبعا احنا ما راح نتكلم عن ال OT intervention at all here, لكن راح نتكلم why we look at it now, why we talk about it. This is very important لأنه واحدة من الكونديشن multiple sclerosis على سبيل المثال MS is an autoimmune disorder causes disturbance of the myelination or myelin sheet in the CNS. So ما في myelination كثيرة. what happened بالذات بالCNS? So what happened? The sheath becomes scars or bleak. Usually it affect 500,000 people in the United States and affect many people هنا في السعودية. يعني I know 2 people who have MS صغار بأعمارهم, هذا هو, it's appear between the ages 20 to 40 بالأعمار الصغيرة. Usually happen in female more than male. We don't know why. Symptoms include muscle weakness, abnormal sensation, or double vision. Double vision is the most common one you would see. برضو abnormality, وعندهم شيء يسمونه remission و relapse, which is result in progressive loss of function, and you will see it. على سبيل المثال بالفورث يير, طلاب الفورث يير الحين في هذا الترم يدرسون الادلت نيورو ريهاب, and one of their lectures is how to actually as an occupational therapy think about how to deal with multiple sclerosis. It's really important to understand the function, why we have myelination sheet, everything, CNS, because this is the foundation for your knowledge to go and actually practice بعدينت. برضو واحدة من الأشياء اللي على طول تعرفها زي كذا, what's the diagnosis, كيف أعرف إنه الشخص عنده, طبعا غير الساينس, المسل ويكنس وذي, الconfirmed diagnosis through MRI. اوكي, ليه؟ لانه بالسنتر نيرفس سيستم you could see المايلينيشن. كيف تعرفون؟ مين يقول لي كيف؟ خلينا نقول كيف تعرف في الام ار اي. وش اللي بيبين لك بالام ار اي؟ Who can answer this? This is a trick question. لانه عارف انكم ما درستوا ام ار اي. طيب كيف فيها مايلينيشن شيت؟ It's a trick question. كيف تعرفون فيها مايلينيشن شيت وبعضها ما فيها مايلينيشن شيت؟ بالام ار اي will not show اصغر, لانه نتكلم على السنترال. خلينا نقول بالبرين, بسهلها بالبرين. اوكي, ما حد عرف؟ احد عنده اجابه؟ you can jump عادي على المايك اذا تبغون يعني answer it. think يلا, anyone. okay, I will go back. ما حد عرف؟ it's a trick question. I will show you here. Let me erase this. شو الفرق بين الجراي والوايت ماتر here؟ ها؟ اوكي, يا بس خلينا نفكر فيها اول شيء, وش الفرق بينهم؟ الوايت matter is myelinated, the gray matter is unmyelinated. فwhat will happen, هذه المyelinated white matter it will become different في البرين، راح تكون كأنها gray matter بشكل مخ. طبعا this is a simple answer لها، فتبان زي السبوتس كذا، ها جراي سبوتس. طبعا في اكثر من دايجنوز، ممكن تكون تومر، اشياء ثانيه في البرين، لكن هذه واحده من الدايجنوسس. طبعا عشان كذا why you have to accompany it with a clinical عفوا clinical what they call it clinical features، انه هل عنده muscle weakness، هل عنده هذه الاشياء vision all of these. وبرضو واحدة من الأشياء اللي الحين بدأوا يركزون عليها إنه جينيتك، احتمال كبير إنه في له جينيتكس في الام اس، سبب إنه المايلينيشن will not occur بسبب إنه في genetic breakdown. عرفت؟ فهمت ايش الفرق؟ ف that's how your clinical reasoning, that's how you would just think about why it's really important to know about this بشكل عام. طيب epilepsy is برضو the most common the second most common neurological condition. It affects 1% of the population. They characterized by short recurrent attack inhibited by electric discharge in the brain. So usually what the trigger them, the light, noise, smells, can be a sense, skeletal muscle can be contracted involuntary, loss of consciousness. كلها هذه بالابيليبسي. Usually have many causes including brain damage at birth, multiple metabolic disturbance, infection, toxics. All of these could happen, head injury and tumor in the brain. This is a helpful link. I'm going to show you one thing and then we will stop. Is there any questions so far? Well, it's easy. طيب I think you can see this now. Again, نفس الموقع اللي تكلمنا عنه, but let just give it a minute. Yes. So introduction to neurophysiology, نفس اللي تكلمنا عنه. عندنا زي I like it لأنه يعطيك أشياء أكثر وضوح. فيعطيك طبعا هنا مسميها سوما, which is the cell body, dendrite, what they are, receive stimulus from the neuron, the receptors, the nodes, what they do, the myelination sheet, the axon, what's the axon, the terminal, what they are. So this is really يعني very helpful إذا تبغى تناظر عليه بشكل عام تبي تنظرون عليه كشيء ثاني. طبعا في اشياء زايده في كان سكيب اهيد وتتركونها, يعني على سبيل المثال الايكون والكربيوم potential, you don't do this, we don't do it usually. والgates, we don't use it. الcommunication, البوست synapse, this is not really myelination here. فيوريك على سبيل المثال how it's myelinated. So I want to add a myelination. So what happened? هذه بدون no myelination. See how the impulse goes all the way and spread. When I add myelination, this is what happened. You see how fast it goes? It goes very fast مقارنة without myelination. The impulse, I mean. So this is one of their يعني function. الإكسون terminal, this is what it looks like. It give you, طبعا ما تحتاجون تعرفون الكالسيوم وهذه الأشياء, لكن it's just give you an information of how it look بشكل عام عشان تسهل, لأنه you need a 3D صراحة knowledge of هذه الأشياء. ف this is usually الويب سايت فيه له طبعا اكثر من شيء, فيه له حتى لو ترجعون يعني لنفس الموقع فيه له الستروك موديل, بس you don't need to go through it. فيه له على سبيل المثال البلد سبلاي, which we will talk about البلد سبلايز بعدين في البرين وفي السباينال كورد. ف it's really good site to look at and just review it when you have a chance. طيب أحد عنده سؤال أو استفسار؟ طيب الأسبوع الجاي يوم الاثنين عندكم محاضرة طبعا من 8 لين 10. أوكي, next Tuesday is هذا اللي هو الريسيرش بي اللي هو الهيلث بروفيشنال كونفرنس. اوكي، فاللي احنا حاليا نعرفه انه لازم انه نفضيكم، لكن حنتاكد ونشوف. تيوزداي حيكون اونلاين، ف it will be a good chance حتى كل الاقسام مشاركه. فاتوقع انه ما في محاضره، وريسكاجولت ونشوف متى الوقت المناسب لها. محاضره تيوزداي we'll give you the information later on. اوكي، اليوم عندكم لاب؟ طيب يس اوكي. الشيء المهم انه both الميل والفيميل send us الجروبس. if you already did that's good، بس اذا ما سويتوها please do it. يا اذا كان اللاب on زي ما يقولون what they call it، اللاب اذا كان in person try to come، وزي ما قلنا protection. اوكي للكورونا. Okay. Anything else? Any other questions? Okay. Good luck, people. Good luck. Again, we'll see you next week. Enjoy your weekend.